Welcome to Good Samaritan Spotlight. Thank you for joining us. My name is Adam Thacker. I'm the Chief Operating Officer, and I'm fortunate to be joined with Dr. Sean Curry, core faculty with our internal medicine residency program, clinic site director, and just a great young physician that we're lucky to have start here at Good Samaritan. So today we're going to talk about the residency program and what it means to have residents at Good Samaritan, what it means to patients, the community, how you as faculty interact, just kind of really getting into all things residency and help to educate the community. So first off, talk a little bit about yourself, your training, and what brought you to Good Samaritan.
Yeah, excellent. So I'm born and raised in the area. So 30 some years ago in this hospital, I was my interest into the world. I grew up across the river in Bridgeport and went to Red Hill. But after that, got lucky enough to go on to Southern Illinois University at Edwardsville. I did my undergraduate degree, and then matriculated to Southern Illinois University School of Medicine in Springfield, Illinois. Had some great training up there. Afterwards, I decided I wanted to pursue a path in internal medicine, but did not want to take on any more debt. So I asked Uncle Sam to pay for the bill for my medical school, and I served the last 7 years in the United States Army, the last 3 which being at Fort Campbell, Kentucky with the 101st Airborne, before coming back to Good Samaritan to really kind of repay another kind of debt to the community that raised me, and able to give back with the healthcare and education of hopefully future physicians in the area. So that's what I'm hoping.
Well, that is great. And both Red Hill alumni, so yeah, we're proud of that.
We're taking over.
Yeah. So talk a little bit about the residents at Good Samaritan. So it's internal medicine, maybe even starting with what is an intern, internal medicine physician see, sure. and what do our residents? It's a 3-year program. Kind of what do they learn going through those 3 years?
Yeah, it's a great question, right? Because internal medicine is a very broad field, right? So internal medicine is known as a doctor's doctor. So it focuses on the patient who's over the age of 18, and it takes us all the way to the end of life, really, and seeing a multitude of different areas. So between the heart, the lungs, the kidneys, the brain, anything you can think of, internal medicine is kind of the overall approach to medical care. We really like to focus on chronic and more complex patients, but we'll see if you have one patient who has one problem up to one patient who has 20 problems. It doesn't matter. We can take care of that kind of person. A lot of the subspecialties that you may heard of or seen, so cardiology, pulmonology, nephrology, GI, they all come from internal medicine, and all of those physicians are actually internal medicine doctors by trade who go on to specialize. So that's who an internist really is at the core, and every good specialist, I say, are likely a great internist. So you kind of add a complex layer to that when we bring in residents, right? So residency is a training program for young physicians after they graduate medical school. So all residents, to include a first-year resident known as an intern, are doctors. They are physicians, whether it be MD, DO, MBBS, depending on where they got their degree from, but they are all doctors. This 3 years after their medical school and their internal medicine training really is just to hone in and to specialize their skill as internist. Always under the direction of an attending physician as myself or one of my colleagues, but they're here to learn on-the-job training, if you will. So like Adam says, it's a 3-year program. The first year, known as intern year, is kind of a broad year where they get to put their hands and fingers in a lot of different areas of medicine. And the second and third year continue that, but by the end of their training, they should have either known, hey, I kind of want to subspecialize, or I think keeping it general for general internal medicine is the best thing for me. So it's a good way to really get immersed in the culture of medicine, especially real medicine in this area.
Yeah, and I want to jump on one of the things that you said regarding this is postgraduate, and so these are doctors, honing their skills and training. as a key element of the residency program is an actual practice, a clinic. That is on the 5th floor of our health pavilion here at Good Samaritan. Seeing a lot of patients every day, thousands of encounters. But sometimes from a community standpoint, I get the feedback if somebody asks me or other individuals for, I need a doctor, I need to establish with a primary care doctor. Oh, I don't want to go to the residency because they're training.
Sure.
These are physicians, and not only are they physicians that are still training, yourself as core faculty, multiple core faculty, that practice has 6 to 8 physicians every day
all the time
in it that are able to look at a patient and help to create a care plan. So maybe talk a little bit about the clinic, what goes on in there, and like I said, see a lot of patients come through there.
Patients coming through there, and we're always taking new patients. I'll start by saying that. But like you're saying, we have the residents who are the primary care providers for a lot of these patients, but there's always an attending physician or a faculty member who has years of experience, have made it through the residency training, board certified, who are there to help guide the treatment plan. And in certain aspects, you'll definitely see face-to-face these attending physicians going with the residents, depending on the complexity of the case or the level of training that the resident already has. But there is always going to be someone there to kind of help guide and facilitate that plan. I think it's a good point to mention as well that in the clinic there are a multitude of services that we can use and rely on. So we have a pretty multifunctional with our clinical pharmacists, our social work. So our residents work with these multidisciplinary teams as well as different things that they can actually do themselves. So doing procedures, so skin procedures, joint injections, we do wool women exam for cervical cancer screenings, but these are all performed by our residents, and that is something that I think is unique to a lot of places that have residents, that we will have these people who are hungry for knowledge and hungry to learn, so they're always up to date on their most procedures and the most academic guideline-based and directed medicine. So that is a benefit of having a resident as a primary care doctor, because you could have some older generation, I will say, physicians who may have kind of lost a little bit on the academic medicine, and I understand that.
Sure.
So having that new and the old, for lack of better words, coming together and having a team of these different types of physicians really is a benefit not only to the patient but to the community as a whole.
Right.
Which I think is, I can't say enough good things about that.
Right. And we see physician shortage across the country in every specialty. As Chief Operating Officer that's over physician recruitment, we're recruiting for all of the specialties that we serve, and so this helps to meet a need through the residency faculty practice. The other thing that impacts is as our residents do graduate, and we're now, our residency program started in 2020, has matured to now we have graduating classes. Yep. Where have some of our residents stayed at Good Samaritan?
Yeah. So we've got actually quite a few, I believe 3 or 4 now, I think 4 actually, on the hospitalist team. So if you've come into the hospital, you may have actually seen some of our graduates take care of you in the hospital. We've got a couple of residents that are down in Evansville as well, at the other side at St. Vincent. One that I could think off the top of my head, who is now down at Evansville as a primary care doctor of the community, which is huge for this region. A lot of our graduates have actually pushed on to fellowship, and hopefully will be coming back to the area. I know a couple of them have talked about coming back to the area after they've subspecialized. So they're starting to leak out and matriculate to the community, which is, again, a huge benefit for everyone around, hopefully for generations to come. And I will mention, not only our graduates, but if you've come to the hospital, you've probably seen our residents and haven't even known you've seen our resident team. So I think it's very, it's growing, it's maturing, like you're saying, and it's only going to go up from here, really.
Yeah, and medical students to residents. I know when I came to Good Samaritan 10 years ago, Good Samaritan was not a academic teaching facility. And today, through the partnership with IU School of Medicine for the residency programs, we now are in that classification as an academic teaching facility. And one of the things you mentioned that keeps learners keeping that bar raised, and medicine is changing tremendously, as is technology and so many other things. So, well, any last comments you would like to make about the program?
Yeah, I think a big one, and we can't harp on it enough, that the physician you will see if you choose to come to our clinic is a doctor, right? And we've all had to start somewhere, whether that be a physician, whether that be a welder, whether that be a plumber, whatever trade you've chosen, you have to start somewhere. And this on-the-job training in this facility gives not only the residents an awesome opportunity to learn from what I think are great physician colleagues of mine, but in a great community that's going to promote kind of that family environment, that rural feel that will hopefully entice them to stay. And I think, I can't say it enough, this is probably going to be the future of our healthcare in this county, is by giving these learners the opportunity to really become immersed in this culture. And I really hope that we keep growing and taking off, but it's going to take not only the hospital, but it's going to take the community as a whole to kind of say, hey, welcome to our
really embrace
place.
it.
Yeah,
right.
Yeah.
We've heard great news on the residency program. We've got community members out there that don't have a primary care physician that are saying, okay, this place is on 5th floor Health Pavilion. How do I get an appointment so we just don't show up?
Yeah.
Our Good Samaritan website, find a provider, can send a link to be able to get connected to the residency. You have phone number, contact information?
Yeah. So the phone number, 812-885-6990, will get you straight to our desk here. And, all you have to do is say, hey, I need a primary care doctor. I think I'd be a good fit for your clinic, and we'd be happy to set you up. Or if you do out and about in the community, come on up to the 5th floor. You can walk up to the front desk, and again, happy to help in person as well. So multiple different ways to get established.
Excellent. Well, thank you for what you're doing as a faculty and leading that charge. It really is a critical strategy to addressing physician shortage in rural areas, and I think Good Samaritan has been identified as ahead of the curve because of programs such as this, and our psychiatry residency as well. So we're growing our residency program. So. Okay. Well, thank you.
Appreciate you for having me.
All right.